Life and Times is made possible through the generous support of the L.K. Whittier Foundation, dedicated to improving the quality of life by supporting endeavors in the fields of medicine, health, science, and education. And by a generous grant from Jim and Ann Rothenberg.
Imagine your new parents, but the doctors say that the best thing they can do for your baby is to remove half its brain. Well, hundreds of parents are told that when they learn that their child has severe epilepsy. How can a child survive with half a brain? You'd be amazed. Good girl! The Swank Mark and Sarah, Hannah and Weston, live in a charming neighborhood in Long Beach. Sarah is a sales rep for Nike. Mark works for a computer company. They were married in 2003, and 15 months later, Hannah was born.
Everything was normal. My pregnancy was normal. I felt great. When she was born, she was with a little birthmark over her eye. And everybody told us, don't worry about it, it's nothing.
But the birthmark was a clue, a marker for epilepsy.
And then at 7 months of age, she was crying. She had had a rough night. She had thrown up and was just sick and feeling well, and Mark had actually gone in to get her.
And that's when we noticed that she was having seizures.
What did you actually see?
So her first seizures, she was out of it. She was sort of unconscious, and her hand was clutching like this, and her jaw.
Oh.
And to be honest, when I first pulled her out of the crib, I had no idea. I didn't know what I was seeing.
They rushed her to the emergency room. She was admitted to the hospital immediately. This is video they took in the hospital.
Hannah, you hear Mom? Hannah, I'm right here. Hannah.
Within 48 hours, the doctors had a diagnosis. Hannah had a rare brain condition called Sturge-Weber syndrome.
It's a vascular malformation of the brain, so it means there are too many blood vessels. And what that causes is that it sort of kills off the brain. The brain dies off because there's too much blood that gets into the brain tissue, and it doesn't have the ability to drain out fast enough.
It was causing seizures. They put Hannah on anti-seizure medication. The drugs worked. The Swanks returned home, and everything seemed to be going well.
Hi, those are your kitties.
But over the next year or so, her eyes showed that the Sturge-Weber syndrome was progressing, affecting a larger and larger portion of her young brain. Then, just before her second birthday, it happened again.
For 2.5 weeks, she twitched like this, straight, until we were able to...
Just constant seizures?
Yes.
Constant, never stopped. And she was able to, function and do things, but she was always, her left hand was always twitching. So that's when we got transferred up to UCLA and met Dr. Mathern.
She was sent in, I think, rather urgently.
Dr. Gary Mathern is a neurosurgeon at UCLA, specializing in pediatric epilepsy.
Ones that eventually require surgery. They can have multiple seizures per day, sometimes as high as over 100.
Well, I remember when he said that on a scale from 1 to 10, this is a 10+ surgery. That was one of the indications that this was as serious as it can get.
And then he told them that the surgery would require removing nearly half of Hannah's brain. That's right, extracting or disconnecting the right hemisphere of this 2-year-old's brain.
We were so desperate to get the seizures to stop that we were willing to do anything.
Removing half a baby's brain may sound extreme, but in fact, much of an infant's brain is developed. Different parts come online, so to speak, in stages. So you can remove sections that are not yet functioning. The rest of the brain, being so plastic, will adapt. Dr. Mathern has operated on infants as young as 3 months old.
I mean, these are not normal brains. These are abnormal brains. So by taking out abnormal brains, we're allowing the normal brain an opportunity to develop as best it can without the burden of the continued seizures.
How can you tell that a little tiny baby has epilepsy? And how early can you tell a little tiny baby?
In retrospect, we've had moms tell us stories about feeling their baby in their womb, and that the baby didn't roll like their other children, that they did these rhythmic thrusting motions, which in hindsight probably was some suggestion that this baby was having seizures even in utero.
What would happen to children with severe epilepsy if they don't get the surgery?
Without treatment, I mean, these are children whose seizures are so severe they're not able to feed. They're not thriving. Okay, so this is a child, if you don't stop the seizures, this child's got a very high risk of dying.
The brain has more seizures, it starts to think that seizures are normal. And they can actually jump over to the healthy side of the brain, and the healthy side of the brain can start having seizures.
That child's at great risk. They can end up with IQ scores less than 50 if you don't intervene.
You know, we really didn't have a choice. We had to do the surgery.
I took out a block or a wedge that would go in from like here to here.
The operation lasts 8 to 12 hours.
All this dark stuff here, this is the abnormal blood vessels that causes that Sturge-Weber condition.
Hannah emerged from the OR seizure-free.
None at all, thank God.
One major hurdle was cleared, but now a whole new set of challenges had to be tackled.
She couldn't sit, she couldn't chew, she couldn't suck on a straw, she obviously couldn't walk.
All right, what are we going to do first?
5 times Hannah comes here to the Miller Children's Hospital in Long Beach for outpatient therapy. Just 5 months ago, she couldn't even lift her head.
Can I have one? Thank you.
Her vocabulary
Can I have another one?
has expanded from even before the surgery. It's mind-boggling.
1, 2, 3, go!
But Hannah's left arm is virtually useless. It was the right side of the brain that was removed, so her left arm is affected. Her therapists, Chris and Eric, try to encourage her to use it.
I know, it's so hard with that hand, huh? I know. We need 2 hands. 2 hands. Ready? 1. And look, ready? 1, 2, 3, go! You did it!
At this point, it's something where she just doesn't like it.
And it's a daily battle.
And if she's playing and it's in the way, she'll pick it up and throw it. You know, she doesn't care for it at all.
The team at UCLA has been performing this operation on infants since the early 80s. Dr. Mathan says there are thousands of children with severe epilepsy who could benefit from the surgery.
We have a few children who've gone on to be near normal IQ. Not many, but a few. Most end up a little behind their peers, but not as bad as if they had continued disease. So you win, you just don't quite win to a complete normalcy.
Mark and Sarah come to therapy along with Hannah as often as they can. Then they continue the techniques at home.
Okay. You're okay. You can do it.
You can get that.
You can do it.
We know that she'll have some limitations on what she'll be able to do, but the whole reason that we did it was to give her the ability to reach whatever potential she can reach.
That she'll just, grow up and be everything that she can be. We're so proud of her. She is an unbelievable child.
Kisses.
When those little kids come back and they may not even remember who you are, but you know what? If they can say, hey, who is this person? You've won. You've won.
What does the cow say? That's what a cat says.
Says the cow.
Cow says moo.
To send a comment or a question to our program, you can reach us by mail at this address: Life and Times, 4401 Sunset Boulevard, Los Angeles, California 90027. You can also call our viewer comment line or contact us the fastest by email at kcet.org.
He wasn't in a car accident or injured in any way, and yet literally overnight he was paralyzed from the waist down. So how do you adjust to life in a